Hello, I'm Carissa Parish, physical therapist, women's health clinical specialist here at Urology San Antonio. And I want to talk today a little bit about the pelvic floor muscles, the muscle function, dysfunction, and pelvic pain. A lot of people harbor muscle tension in their pelvic floor muscles. So therefore, pain happens. Muscle tension is a big contributing factor to pain, to pelvic pain. So symptoms might be frequent urinary tract infections, constipation, incomplete bladder emptying, kind of retention, and pain with intercourse. That's what I want to talk about today, is a little bit more about the muscles, how to relax the muscles, and demonstrate a few exercises to help you recognize how to relax your muscles. This is extremely prevalent. 1 in 4 women will experience pelvic pain, and 2 to 10% of all men will experience pelvic pain in their lifetime. So we have our pelvis. This is the female pelvis. We have the pubic bone in front, the tailbone is in back, here, and then you have your 2 hip bones here. The pelvic floor muscles originate right behind that pubic bone, and the muscles wrap all the way to the tailbone like a hammock or a sling. So there's layers of muscles that we have control over in here that we can't see. So the muscles wrap around the urethra, the vaginal, and the rectal regions in the female, and the urethral and rectal regions in the male. So these muscles need to be resting, and then when your brain says work, they need to work all the way and then rest all the way when your brain says rest. So we have a connection between way up here and way down here in our pelvic region. So when I breathe in, and as I breathe out, I can allow my pelvic muscles to melt away and relax. When I'm breathing in, I'm using my diaphragm, my respiratory diaphragm. And as I breathe out, I'm allowing the muscles that I'm sitting on, the pelvic floor muscles, to sink and let go. So another great way to relax the pelvic floor muscles is to lean over and just rest as if you're taking a nap at your desk. This position puts the pelvic floor muscles in a lengthened, relaxed position by default. So you're just breathing and relaxing for about a minute. You can hang out in this position about a minute and just allow the muscles to keep relaxing with every breath you take. Another great way to relax the pelvic floor muscles is the yoga child's pose. So your knees can be together or apart, but in this position, again, I'm breathing and allowing the muscles to just let go. I'm not holding any tension in my pelvic floor. So you can make it very restful. I hope this was informative. If you have any questions, please ask your provider for referral to physical therapy, and you can look on the website urologysanantonio.com.